Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Good morning.
Good morning, Dr. Mencia.
Good morning, Ina. Welcome to the show. You're going to be my co-host today.
Yes, I'm replacing Anita today.
Yes, Anita is out on assignment. We have the wonderful Cure Symposium today. And I hope people can attend there. I know AGI is having a booth there. Mm-hmm. And some of your staff had been assigned to be at the...
from dental and medical departments.
From both dental and medical,
yes.
Which is great. So if you go to the Cure Symposium, look out for AGI booth. We are going to be there. And if you have questions, feel free to talk to our wonderful, knowledgeable, beautiful, educated staff that will be there representing us. We have Richard at the control, keeping us checkmate, making sure that we don't mess up Anita's show. So today we have a very interesting topic, Ina. We want to talk about constipation.
Yes.
Unfortunately, is one of those topics that individuals are sort of shy to talk to the doctor about constipation, especially ladies. And the problem with that, Ina, is that when you suffer silently with constipation, the consequences are horrible. For example, the most common thing that we hear about is people developing hemorrhoid due to constipation. But people tend to treat their constipation on their own. They do not work with a doctor when it comes to constipation. So, for example, they go to a pharmacy or a supermarket and they start buying laxative. And they start taking laxative chronically because they will notice if they do suffer from constipation, that only with laxative they can obtain to have a bowel movement before they get pain or nauseated or start vomiting and get all the symptoms that we'll talk later about that. The problem with taking chronic laxative is that it weakens the wall of the large intestine. And by making them weak, it will then become a vicious cycle and make the constipation worse. So if you have people that take, for example, Senna every day or 2 times a day for a long period of time, eventually that drug doesn't work. And it's not because your body, quote unquote, got used to the Senna, but because it has weakened the muscle. And the intestine is like a snake. It moves what we call peristalsis. So that peristalsis, those muscle movements like a snake, is what make the content of the lumen of the bowel go down into the toilet bowl and help you have a bowel movement. And when the large intestine are getting overloaded, you feel the urge to go. So it's a mechanism that God has created when it comes to your gut, that it works excellently when we respect it and we listen to it. Sometimes because of our profession or things that we do, we go playing golf or we go to listen to a group of lecture like the Cure Symposium today, but you neglect to go to the bathroom because you don't want to miss anything. And you can go ahead and start building up stool in your bowel. And if you keep neglecting that, then the stool tend to become hard. Now, the way the intestine work, digestion starts from your mouth. So when you start masticating food, the people that don't have all their teeth, and the next half hour we're going to talk about that, people that don't have their teeth, all their teeth, or eat without denture, they will not masticate the food. And if you don't masticate the food, you're going to swallow whole pieces of food elements that you are now leaving it up to your stomach and your small intestine and eventually the large intestine to do all the digestion. And that's basically impossible. And that's why you see if you take a person's stool and analyze a person's stool that is edentulous, that have no teeth, and analyze the stool of a person with all their teeth that masticate their food properly, the one with no teeth will have pieces of meat and vegetable in their stool, where the other person will have just stool content. So studies have already been proven that the true digestion starts with your mouth, and as the food go down, then digestion continue between your mouth and the stomach. The esophagus is only a pipe that connects the two portion of the digestive tract. But the stomach then become very important because the stomach have high acidity. Mm-hmm. And the acidity is important because acid destroyed the ingredient. It sort of separate the protein to one side and the calcium to one side and the elements that your body need go to one side. So it starts sort of stratifying things so that as you go down to the small intestine, the iron get absorbed a certain area, your vitamin B12 get absorbed a small area of your intestine. And it's amazing because if you look at the digestive tract from mouth to anus, and you take it out of a human body and you stretch it out, you know how long that is? It is the length of a football field. Mm. American football, not soccer. The length of a football field. Now, if you look at the intestine being stretched, the length of a football field, you have like 4 to 6 inches that will absorb B12. So if that area is not working or the transit gets slowed down through there or go through fast, you won't absorb your B12. The iron is the same thing. And all the elements that our body need have what we call like little zone or windows that are dedicated, have the receptor that will recognize that this is a B12, this is an iron element, this is a calcium or a magnesium, will recognize them and absorb them. And that's why you see in developed country, you see a lot of people taking supplements because they are not absorbing from their food intake. But the best source of all those elements and nutrients and vitamins is food intake. So we need to work at digesting better, starting from your mouth all the way to the rest of the tract. Now, let's stop at the stomach there a little bit because a lot of people at a very young age start taking what we call anti-acid or proton pump inhibitor, which are even stronger than anti-acid. So if you take a little Maalox or something like that over the counter, that tend to work with the acidity, making it less acidic and more alkaline. But remember, you need acidity for digestion. So people that abuse antacids, Tums, anything that decreases the acidity of the stomach, and you do that for a long period of time, well, it will affect not only your digestion, it can affect your thyroid, and it can even affect your bones and speed up the development of osteoporosis. That's why it's important that if you took anti-acid for a little upset stomach, eventually you want to work with your doctor so that you can come off the anti-acid and try to work more with the diet. Sometimes the acidity is precipitated because we eat spicy food or certain food that we eat, alcohol intake on an empty stomach, many things that can affect your stomach so that you can modify your lifestyle so that you, in reality, you do not want to take anti-acid for life if it's not necessary. There are certain conditions in medicine that we have to just bite the bullet and leave on anti-acid. But as you well know, the philosophy of the practice is let's get to the root of the problem and let's find out why we are developing this condition. So then got the small intestine. The small intestine will do the digestion. Now, one thing that people neglect is that once you have eaten, you know what the small intestine need? Just water. Just water. And people have a tendency of not drinking water. We need water. So the water is going to help the wall of the small intestine digest and absorb what's going through the lumen.
Okay, Dr. Mencia, is the temperature of the water matters? Do we need to drink?
That's a great question. Yes. I remember going to Malaysia, and in Malaysia for breakfast, they give you warm water. They give you warm water. And we were up in a mountain in Malaysia. It reminded me when I was in medical school, I was a doctor. And it reminded me when I was in medical school that we used to take the intestine of a frog and we put alive, we just take the intestine to look at the intestine. So it's like doing surgery on a little animal. And we flush the frog through the intestine with cold water. And the motility, the movement, the snake we were talking about at the beginning, slow down with cold water. Where if you take warm water, the motility will speed up. So that's a great question, and that's a fact that warm water will help speed up the motility. So if you're taking a lot of antacid and the abdominal wall is weak, it is important to speed up. Why don't we get the phone number of AGI for our audience, since this is Pencil Talk?
Yes, it is. We have 2 offices, one in Boynton Beach and one in Fort Lauderdale. A phone number for Boynton Beach office is 561-270-6494. And phone number for Fort Lauderdale is 954-489-1345. And you can visit our website at agifl.com.
And for those people that don't know what is AGI, is Adult and Geriatric Institute, Medical and Dental Center. And our philosophy is optimizing longevity through wellness and prevention. And it's a multi-specialty center for those of you that are listening to us, because we are usually at 7 o'clock. It's a multi-specialty center that will cater to you in both dental and medical practice. And also we have all the subspecialists, dermatologists, ophthalmologists for your eyes, podiatrists for your foot, neurologists for your brain and your spine and nerves and the rest of the body.
Orthopedic doctor
that specializes in back surgery, urologist for your prostate or your bladder that is hyperactive.
And we have dietitians.
And we have 2 wonderful dietitians that will work with the patient, whether they are trying to lose weight, gain weight, having problem with their diet, that have gluten intolerance, for any condition that have to do with your diet, or any medical condition where your diet is important in the management. So the dietitian become an excellent portion of the practice. So talk about the dental department too.
We have a dental department who is, this is a full dental department which we can do starting from extraction to the full mouth reconstruction.
Yeah, when you are the dental department, just like the medical. If you recall, when we started, the medical department, it was, the geriatrician and the internist. And then eventually we started getting all the subspecialists coming in.
Right.
Dental started the same way, and now we're getting all the subspecialists, the orthodontists, the periodontists. We have the hygienists working. So it's a full-blown department of, and that's what AGI, for those people that are listening to us for the first time. Because again, we tend to be here from 7 to 7:30, but...
And the dental is open today, and we welcome all the emergencies, all the walk-ins.
Right.
We have a hygienist today in the office.
Right. And it's important also to let the audience know, because sometimes, emergency, like my father used to say, you don't put them in the calendar, they just happen to come to you.
Right.
And you might have an emergency coming at you on a Sunday. And if you need if you need the AGI dental department on a Sunday, do call the operator. One of our dentists will get to you. And last Sunday, we have 2 emergencies that the patient needed to be seen. So I have one of my dental and one of my dentist assistant to come in, and we did 2 extractions. So that's so important, because sometimes when you have a dental emergency and you let it go, it can become an abscess. It can become very frustrating, and it can become a long process for the person. So if you have an emergency, we are not usually open on Sunday, but we will go if it's a true emergency that you have. So if it's something that can wait, and the dentist will basically do an assessment over the phone talking to you, and if he or she feels that it's an emergency, then we will go ahead and talk about that. But we're going to have in the next half hour Dr. Benzit, who is one of our dentists, talk about that department. Let's go back to constipation. So we are at the small intestine now, right? And when you are at the small intestine, again, the most important thing, because whatever you're going to eat, if you have all your teeth, if you are not a dentist, you have all your teeth, you're going to start digesting with your mouth. As the food go down, the most important thing is water. If we drink plenty of water, then it's going to help the process of digestion through the small intestine. And at that point, we're still breaking down food. Keep that in mind. From the stomach on down, you are breaking down food. And as we go down, then it goes to the large intestine. Now, the large intestine is basically responsible for absorbing all those nutrients into the system and letting out the waste material. And that's what the stool formation is. Stool is supposed to be waste material. So if you start digestion from the mouth, a person with no teeth trying to eat a piece of meat, that's not waste material. It's just food that is undigested that is going to go down. So digestion needs to be processed properly from mastication all the way down to stool formation. Now, in stool formation, the way God made this body is to keep a balance between the inside and the outside. It's what we call in Chinese philosophy the yin-yang. Keeping the balance between the inside and the outside. So if you are dehydrated, meaning that you don't have enough volume of water inside your body, if you don't have water, well, let's say there is a big party going on, and it costs $1,000 to go and sit at that party, and you don't have the money, you are not going to the party. Right. So if you don't have water and the stool is asking for water, you don't have water, you are not going there. So the stool is going to be very dry from the beginning. 2 things are going to happen. One, your nutrients that are waiting to be reabsorbed into the body won't come in because you don't have money to pay the toll. So nutrients won't come in. Number 2, the stool become very hard because the stool need that water to help flush things down. So it's like if you have a toilet bowl, instead of filling the tank all the way to the top, you only fill a quarter and you keep putting stool in there, guess what? It's going to clog up. It's going to, right? Yeah. So that's constipation. Now, what are the consequences of constipation? When the person is constipated, the number one thing people will complain is hemorrhoids. But the hidden part, the part that people don't know of, is that when the wall of the intestine start getting weak, you get this little balloon on the wall of the intestine called diverticulosis. And as you get a lot of those diverticulosis, they are like tiny little holes when we go and put with the scope to look at the intestine. Well, guess what? When you eat seeds and nuts and any of those things, and the stool is moving very slow because you are constipated, then the seeds and nuts can lodge into one of those little holes, and the diverticulosis become inflamed, and it becomes diverticulitis. It becomes a medical emergency. And especially in the aging population, when they develop diverticulitis, it can be so undetected, so smooth, so slow, so quiet that you just feel a little bit of ache and pain, usually on the left lower quadrant. And people tend to let it go, and it become an abscess, and it kills people. So diverticulitis can kill you, especially in the advanced age, in their 90s and beyond. But it can become a catastrophe, also a younger person, because it can explode. The abscess can just open up inside your intestine. And in that case, usually what we have to do, we have to go, it's a medical emergency. So to save your life, we have to open the abdominal wall and take out all the pus out of there, and then we have to leave it open. We cannot close it. Because once you have an infection, you cannot go in and suture that. You have to leave it open. So it's a horrible catastrophe that the root of that problem was simple constipation. And people will spend millions of dollars on treating constipation quietly without talking to the doctor. And when I usually ask my patient, if they do suffer from constipation, if they have hemorrhoids, if they develop. So I go through the symptom and the complication because sometimes they don't want to talk about constipation.
So the hemorrhoids, this is the beginning stage of constipation.
That's one of the initial
complication
of constipation.
Okay.
Right. So once you start developing hemorrhoid, what happens is you start straining yourself to go. And the end part of the intestine is just full of blood vessels there. So when you start strengthening yourself, you start developing, like you develop those varicose veins on your leg. Right. You develop at the anal on that part, and it balloon out. It just weaken the muscle. Huh? Also also the blood, the senna and the colace and all that stuff. At the beginning, we say when you take them chronically, it weakens the wall. So it weakens the wall also of the anus, so then it becomes easy to dilate and develop hemorrhoid.
Let me ask you the question. How many times during the day the healthy and adult person should go to the bathroom?
That's a great question. Because we all have our baseline, okay? A person, I'm going to take you to the streams. You can have a person that for that person, a normal bowel movement is 3 times a day. So 3 times a day they have to go. And that's their norm, that's their baseline.
Right.
And you have a person that they go 3 times a week. And that's their norm. When to become constipated? If you go once a day and you go, let's say, 3 days without going.
Okay.
Automatically, that's definition of constipation. So when your bowel movement decreases by at least 25%, you should be concerned about constipation and start questioning. Is it that I'm not drinking enough water? Is it that I'm abusing the laxative? What's going on that I'm getting constipated?
So what can cause the constipation? Can stress cause constipation?
Stress is one of the causes of constipation. The number one reason we mentioned, that was dehydration.
Right.
A person being dehydrated. Medication can cause constipation. If you take a lot of water pill, that will make you urinate a lot, and you don't replace the water, you can become constipated. Your thyroid, if your thyroid is sluggish, is hypoactive, what we call hypothyroidism. Hypothyroidism can cause constipation. Person in their diet, if in your diet you don't eat enough fibers, then the lack of fiber also we call constipation. So it's maintaining that balance between your diet, your fluid intake, and always, when you take medication, if you do suffer from constipation, read the side effect of the medication, because all you need to have be prone to constipation and then take 2 or 3 medications that will make it worse, and you can have a catastrophe. One of the things you see, a person that is constipated and they get backed up so much that they start getting nauseated and they start throwing up.
Right.
And it's not your pancreas, it's not your gallbladder, it's not that you have gallstone, it's that you are so constipated that things, if it's not going down, it's going to start coming up at you.
Why is it so common in pregnant women to get constipated?
That's a great question. Yes, because once you are pregnant, right, you have the fetus inside, and the fetus will lie down on the intestine, and it will
press.
So it's important that a pregnant woman is active. Just like any, even a non-pregnant individual. If you become sedentary, you will become constipated because movement tend to help.
Drink a lot of water and move a lot.
And move a lot. Stay active.
Yeah,
Stay
exercise. Active. Okay, so do we want to give the phone number?
Yes, why don't we give the phone number before we go to our break and come back with Dr. Benzit.
So this is Pencil Talk. The phone number for Fort Lauderdale office is 954-489-1345, and for Boynton Beach office 561-270-6494.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.